ALIF, or Anterior Lumbar Interbody Fusion, is a very powerful yet minimally invasive surgical option available to treat a variety of different pathologies and problems. If you're a patient with back pain or leg pain, and have had scoliosis or spondylolisthesis or degenerative disc disease, you may be a candidate for this procedure. It may sound a bit unnatural to go through the belly to treat a spinal problem. In reality though, it allows me to treat the problem without having to cut a bunch of muscles in the back and preserve those paraspinous muscles that you'll need for years to come. The procedure is done under general anesthesia. That means you'll be asleep throughout the whole procedure. Before we start surgery, the anesthesiologist will perform what's called a tap block. That allows for those muscles inside the abdomen to be numbed up and stay that way for about 2 to 3 days, and that'll help significantly with post-operative pain. After that, you'll be on your back, which is called supine, and the vascular surgeon will come in to help me with the approach. Once we get down to the disc, I then come in to perform the surgery. A one-level surgery that usually takes place between L5 and S1 takes about an hour, and if it's a two-level surgery, I would say about 90 minutes for the surgical length of time. Let's delve in deeper. This is an example of spondylolisthesis. One vertebrae is slipped forward compared to the other, and the nerve that's in between the two is crushed and compressed between the bones. That causes sciatica and back pain. The goal of the surgery is to place that spacer in between the two vertebrae to open up the space and reduce the slip. So now you're put to sleep, and the anesthesiologist has already done the tap block, and now it's time for surgery. You're on your back, the belly is draped out, and the vascular surgeon will come in to give me access to the disc space. That typically happens after a fluoroscopy shot to locate the disc space, and from there a small incision is made right below the umbilicus or the belly button to then, in a minimally invasive fashion, get access to the disc space through the abdomen. Once that's done, I then come in to perform the spinal aspect of the surgery. I carefully cut into the diseased disc and remove the entirety of the disc to then be able to place a spacer into that disc space and reconstruct the spine. This 3D printed titanium spacer allows for your spine to become taller, for the slip to be fixed, and for us to decompress your nerves and help your back and leg pain. Additionally, the spacer itself is very hollow, and it has room for allograft, which is material that would facilitate and speed up fusion to be packed inside the spacer, and eventually the two vertebrae, say L5 and S1, are going to be fused together. Once that's done, we have two options to fixate the spacer to your spine. One is through 2 screws or 3 screws through the spacer into the vertebrae of L5 and S1, and the other is to place a plate on top of the spacer and then put in screws into the vertebrae to fixate the interbody cage or the spacer. As mentioned before, the procedure takes about an hour. It's very safe, very effective, and the vascular surgeon then closes the wound and you'll be woken up and sent to recovery. Here you can see a comparison of the pre-operative spine with the slip and the degenerated disc, and the post-operative spine where it's taller, it's reduced, and the nerves are happy and decompressed. That means no leg pain and improvement of your back pain after the surgery.